Hi everyone, my name is Ellie, and this is the story of the worst mistake I have ever made in all my years of working in the emergency department. So, I work at St. Joseph's Hospital in Nashua in the ED. I've been working there for about 2 years, and I've been working as an LNA for about 4 years. So, this doesn't seem like that big of a deal or that embarrassing, but my dad works with me in the emergency department as a doctor. So I have his eyes watching me all the time and his colleagues who wrote me letters to help me get into PA school. So it's a lot of pressure for me to be perfect in everything I do while I'm at work. This being said, I'm not a perfect person, so sometimes that becomes a little bit of an issue. And this story is one of those issues. So the way the ER is set up is a big circle. If any of you have ever been there before, I hope that you haven't. But it's a big circle, and there's a nurse's station and a doc box right behind it. And then across from that is the bathroom. And that's going to be really important for later in this story. So, some of the duties that I do are small things, EKGs, checking on patients, helping out with small things that the nurses and the providers can't do. So, one day, a patient rang their call bell, and I didn't think anything of it because I go into patients' rooms and take care of them all the time. And they asked if he could use the bathroom. So naturally, I helped the man get up and walked him to the bathroom, which was right across from the nurse's station. I got him settled and told him, pull the red string when you're ready for me. And so I was standing outside of the bathroom because I didn't lock the door in case other people came by, then they wouldn't go in and interrupt his bathroom use. So I was standing outside of the door and I was chatting with my father, who was standing outside of the dock box. And all of a sudden, behind me, I heard a huge thud and the door started rattling back and forth. Naturally, everyone looked up from their desk because it was a loud thud and ran over to the bathroom. So I opened the door and I saw the patient had fallen on the floor and there was a pool of blood around them. And I was so confused and so mortified. I'd never been so embarrassed. I've never had anyone fall on my watch in all my 4 years of working as an LNA. So this was a big deal to me. So everyone came in and they were helping me. They were taking his vital signs, making sure that he was okay, didn't have any additional pain to what he was already there for. And we got him up, got him back to his room, took him to get a CAT scan and everything. But all while this was happening, my face was beet red and my hands were dripping sweat because my father saw the whole thing and I already have all this pressure to be perfect and he's watching over me, and I could tell that he was super ashamed of what had just happened because he expects me to be perfect and everyone there thinks I'm perfect. So it was a huge deal for me. So once we got him all settled back into his bed and we got him to do all of his tests and we were waiting on the results, I started getting super anxious, and so I started crying because I was so embarrassed that that had just happened and so afraid that I was going to lose my job. I didn't, but I was so scared. So then the test results came back, and it turned out that he was okay. He didn't have any additional injuries or anything other than what he was there for. And my father came up to me and was talking to me, and he said, yes, that patient had a GI bleed. So the reason this is critical is because when someone has a GI bleed, they're losing a lot of blood, and so it makes them more likely to pass out because of all the blood they're losing. So this patient lost a bunch of blood when they went to the bathroom, and then when he stood up, he passed out and fell over, and that's why he was on the ground. Not because of anything I did wrong, but still I was super embarrassed, so I continued to cry. And everyone kept coming up and comforting me and making sure I was okay. And the more I talked about it, the more I realized it was going to be okay and that everything was okay and that my dad wasn't actually that ashamed of me. So in the end, the patient was okay. He didn't have any major injuries or any other ailments other than what he had come into the ED for in the first place. Had I known that he had a GI bleed, none of this would have happened, but mistakes do come out of nowhere. I may have been crying, horrified, and a straight up mess, but everyone was so kind and made me feel so much better about the situation. And even though this was the most embarrassing thing I've ever done and the worst mistake I've ever made, I learned a huge lesson, and it turns out that my dad wasn't even as disappointed as I expected him to be. Thanks.